Today at the SIOG 2019 meeting, I presented an abstract on patient preferences and health outcome prioritization among older patients. The reason we did this study is because we have seen that older patients may value other outcomes over survival, which is the usual outcome that we study in oncology. So patients may value quality of life, cognition, or independence over survival. However, very few studies include these patient-centered outcomes, so we wanted to see what was more important to patients, to have them prioritize their preferred outcomes, and to see if there were any patient characteristics that correlated with choosing other outcomes over survival. And so we included 241 patients that were also enrolled in a prospective trial which was examining a geriatric assessment-based intervention. And before starting chemotherapy, all patients underwent a geriatric assessment. And as part of that, they answered 3 health outcome prioritization tools. And in summary, what these tools ask is for patients to prioritize several outcomes according to their relative importance. So patients had to rate what was more important for them: survival, quality of life, or being free from symptoms. And we also asked them what was more important, their current quality of life or quality of life in the future, because we sometimes offer treatments that provide benefits in the future but may cause losses in present time, like toxicity, etc. So we had very interesting findings. We found that although 60% of patients rated survival as the most important outcome, 42% rated other outcomes as more relevant than survival. And almost 3/3 of patients rated their current quality of life as more important than quality of life in the future. And when we asked them to describe what was more important to them, we found that almost 80% of patients said that they would rather live a shorter life than lose their thinking ability, so cognition was highly valued. And almost 60% said that they would rather live a shorter life than lose their ability to take care of themselves. So what this tells us is that extending survival may not be the most important outcome for our older patients, and that we must think about all these other things when offering treatment for patients. And I think that the take-home message from this is that oncologists should discuss these outcomes with patients before starting treatment and align their decisions with what's most important for the patients. So this study was conducted at City of Hope, which is an NCI-designated cancer center in California. And all the patients were 65 and older, and they were starting a new line of chemotherapy for a solid tumor. And they were English-speaking patients. And of course, this is very relevant because the way in which we prioritize outcomes may be highly influenced by our family structure, our cultural background, our educational level. So this is true for a population in a Western, highly industrialized nation, and it may not hold true in other settings where preferences and the way patients view life and the outcomes of treatment may be different. But we are working now on trying to tailor these tools for other populations, particularly in Mexico at my institution. We are working at trying to figure out if these tools are appropriate for older adults with cancer.